let's go to case study 2023. Question 1, 2023. So follow with your pamphlet. Follow with your pamphlet. I must not send the questions in this group. It's not a must that I must send questions in this group. So have your pamphlet. Be reading as I'm going. Question 1. Anemia caused by failure of bone marrow to manufacture red blood cells is known as iron deficiency anemia. Iron deficiency anemia is not right. Aplastic anemia, pernicious anemia occur when there is deficiency of vitamin B. Folic acid deficiency, anemia. Folic acid deficiency anemia is same like iron deficiency anemia. So virtually we'll be talking about aplastic anemia. So aplastic anemia is the right answer when the bone marrow produce is not able to manufacture good red blood cells. One of the significant symptoms of myomas of the uterus is significant symptoms of myomas of the uterus. Myomas means cancer, or let's say tumors of the uterus. One of the significant symptoms that is found with everybody, all women that may have tumors, are menorrhagia. We have amenorrhea. That's amenorrhea is absence of menses, right? B, menorrhagia, excessive bleeding. C, dysphagia, difficulties in swallowing, which is not that. Dyspareunia, painful sexual intercourse. So the right answer is going to be B, right? Menorrhagia is the commonest symptoms with all those who are having myomas of the uterus. Question 3, the bacteria that causes pyelonephritis is the bacteria that causes pyelonephritis is E. coli. E. coli, take note of that, and it's a gram-negative bacteria. We have A, gram-negative bacteria, we have B, gram-positive bacteria, we have C, Mycobacterium tuberculosis, that's Mycobacterium. Then we said the next D, A and B is correct. No, A is correct because it's a gram-negative bacteria. Question 4, this disease comes as a result of autoimmune deficiency of autoimmune mechanism of the body. Autoimmune means the body system fighting against itself. A, glomerulonephritis, nephritis, that's B. C, urethritis, that's inflammation of the ureters. B. D, pyelonephritis. So the right answer is going to be A, right? Because glomerulonephritis comes as a result of an autoimmune effect. The body system fighting against itself. That's the right answer. Question 5. This question 5, an inflammation of the prostate that causes painful urination is known as inflammation of the prostate that causes painful urination is known as prostate cancer. Right? Inflammation, take note. When you start seeing inflammation, you don't need to even be stressing yourself in that question. You're not supposed to even spend 2 seconds in that question. Inflammation of the prostate that causes painful urination is known as prostatitis. From the word medical term, medical terminologies, itis, just go straight away to the B, the right answer. Inflammation, or because they have given us various options: prostate cancer, prostatitis, urethritis, benign prostate hyperplasia. And if a student is in this group and has been following carefully, he will notice that when we started, I made mention of the fact that questions are these HND questions are main. One of the purposes of the questions is to distract the student, and when you don't know, you will be distracted. You'll be one of those who will fall prey. So one of the aims of these questions is to distract you. So go and listen back to the audios and listen over and over again. Find out from those who have been here and listen. Let them play it to you or send to your phone. You listen over and over again and know that the aim of questions is to distract you. The aim of questions is to test you whether you really know what you have. The aim of question is to test your confidence. And when these things are not there, forget it. People fail now. People have been failing each and so. Question 6. Inflammation of the gallbladder is known as cholelithiasis. Cholelithiasis is when stones are found in the gallbladder. Hepatitis is inflammation of hepatic cells, that's liver cells. Cholangitis is far from that, right? So the right answer is going to be cholecystitis. That is the right term for inflammation of the gallbladder. Question 7. The cardinal sign of diabetes mellitus includes cardinal sign of I think I've mentioned this, right? Polyuria, polyphagia, polydipsia. Those are the cardinal signs all A, B, and C are correct. D, all of the above is correct. So all of the above is going to be correct. Question 8. Elephantiasis is known as uh, lymphadenopathy. Lymphadenopathy, problems with the lymph nodes. You know that it's not true, right? Because elephantiasis, if you want to talk about the fact that that the lymphoid tissues have problem, or the lymphoid tissues or the lymph tissues or lymph nodes have problem, there are many conditions in the body that may present with lymphadenopathy. Lymphatic filariasis, that's true. Lymphadenitis. And then D, lymphadenoma. So you see that B is the right answer, right? Lymphatic filariasis, that is where elephantiasis come about, right? Which drug is commonly given for the prevention and treatment of the disease in question 8 above? Question 8 above in our community. A, ivermectin. B, metronidazole. C, antibiotics. D, none of the above. You see that ivermectin is the right answer to that question. And you and I know in pharmacology, you were told in pharmacology that every drug has 4 different names. That ivermectin is also called metizan, right? Question 10. Anemia can be classified based on morphology. Anemia in which there is abnormally large red blood cells known as macrolytic anemia. B, microlytic anemia. C, nomocytic anemia. D, none of the above. Macro and anomaly large is macrocytic anemia. Just like I said before, I said there are more than 400 different types of anemia. More than 400 types of anemia that you may have ever known. There's vegetative anemia, there's macrolytic, there's hemolytic, there's hemorrhagic, iron deficiency, pernicious, aplastic. There are many. So now in a case like this, we think they are macrocytic anemia, right? Question 11. In cancer treatment, when symptom relief is the main goal, is known as palliative care. A, radiotherapy. B, palliative care. C, chemotherapy. D, biological therapy. See that radiotherapy, chemotherapy, biological therapy, they are all cancer treatment, like they are all measures or they are all methods used in the management of cancer. And we are saying B is the right answer, right? When the symptoms, the main goal is palliative care. Question 12. Common signs and symptoms of chemotherapy include alopecia. A, D, dryness of the skin. C, nausea and vomiting. D, all of the above. Question 12. Question 12, right? Alopecia is the absence, barrenness of the hair, right? Barrenness of the head, the hair is lost. Dryness of the skin. So chemotherapy is a very rough. Some of you may have had patients that had cancer. The treatment is so rough that the right answer to that question is going to be all of the above is correct, because all those signs and symptoms are something that are common with patients that may have gone through cancer treatment. Question 13. Which of the following bacteria is involved in the development of peptic ulcer? A, Helicobacter pylori, Staphylococcus aureus. E. coli, Streptococcus. So the right answer is going to be Helicobacter pylori, right? Then question 14. Omeprazole for the treatment of peptic ulcer falls under which class of drug? I think I just mentioned that. Already. A, antacid. B, proton pump inhibitor. C, antihistamines. D, antibiotics. The right answer is going to be proton pump inhibitor. That's where omeprazole falls. Which of the following definition best describes gastritis? A, erosion of gastric mucosa. B, inflammation of gastric mucosa. C, inflammation of diverticulum. D, reflux of stomach acid into the esophagus. Erosion of gastric mucosa. Inflammation of inflammation of the gastric. Yeah, because when it gets inflamed, when the acid drops on it, you start experiencing pain, right? So it must inflame, right? There must be inflammation of the gastric mucosa. Question 16. The nurse is reviewing the record of a female client with Crohn's disease. Which stool characteristics should The next aspect to note documented in patient's client. Crohn's disease. Crohn's disease, right? Crohn's disease is a GIT disease. When you guys were doing diseases of the GIT system, of the GIT or the gastrointestinal system, you will find that diarrhea. Crohn's disease you don't really experience diarrhea with Crohn's disease. Though Crohn's disease is actually a malformation, it comes as a result of some proteins that appear in the GIT that are not needed, and it causes severe problems. Chronic constipation. Constipation alternating with diarrhea. Stool constantly oozing from. Now, take note of that. Like I said, some of the symptoms of Crohn's disease, we have abdominal pain. Like I said, it's an abnormality that comes with foodstuffs, some particular type of proteins in the body, right? They appear in the body, and then they start bringing forth malformations. Like we start experiencing abdominal pain, watery stool, even constipation or heart stool. You can experience that. Most often at time, you get constipation alternating with diarrhea. That is the strict, that's a clear example with that. 17. Aka is a 46-year-old admitted to the hospital with suspected diagnosis of hepatitis B. He is jaundice and reports weakness. Which intervention will you include in this care? He is jaundice and reports weakness. Which intervention will you include in his care? A. Regular exercise. Low protein diet. C. Allow patient to select this meal. D. Rest period after small frequent meal. So we said Aka is a 46-year-old admitted to the hospital with suspected diagnosis of hepatitis B. He is jaundice and reports weakness. Which intervention will you include in his care? That's question 17. A. Regular exercise. B. Low protein diet, right? Allow patient to select his diet. Those are is off. Regular exercise is off. Allow patient to select his diet. No rest period after small frequent meals. After small frequent meals. You see, it doesn't make sense. The only thing is protein is low protein diet, right? Because all the other answers, it doesn't make any sense. The patient will not select his diet, right? Rest period after small frequent meals. It may be true, but now the issue is that with hepatitis B comes as a result of foodstuffs. It doesn't come as a result, not necessarily a sexually transmitted infection. 18. Darcy has a diagnosis of ulcerative colitis and has a severe abdominal pain aggravated by movement, renounced tenderness, fever, nausea, and decreased urine output. This may indicate which condition? A. Fistula. B. Bowel perforation. C. Bowel obstruction. And D. Abscess. Darcy has a diagnosis of ulcerative colitis and has a severe abdominal pain aggravated by movement, renounced tenderness, fever, nausea, decreased urine output. Which this may indicate which condition? Now, take note of that. We are saying nausea and vomiting, right? Now, let's look at the answers. Fistula. Fistula doesn't have, you will not experience such symptoms with fistula. Bowel perforation. If it's bowel perforation, you will not really be experiencing nausea that much. So then D, absolutely. Only abstract answers are A, B, and D. So the right answer is going to be bowel obstruction, right? It's going to be bowel obstruction, and that aggravates with movement because when during movement, peristaltic movement increases. So take note of that. What is the major risk factor for stroke? A. Obesity. B. Diabetes mellitus. C. High blood pressure. And D. Family history of stroke. You may have a family history of stroke, and if obesity is also a risk factor, but it's difficult to have hypertension without obesity, right? Then diabetes mellitus is also possible, right? But with high blood pressure, the lumen of the blood vessel reduces. Somebody can be obese, but the lumen of his blood vessels are not reduced, and so the person may be fat, but the blood vessels blood flows without any resistance. So